What we have here is really, an overview of a system that's in crisis.
Have you been able to see a doctor or get the elective surgery you need? Chances are the answer is no, and you're not alone. The Canadian Medical Association putting a figure on the cost of COVID and how it's weakened our medical system.
Over a few month period, 4,000 excess deaths, 20 Canadians losing their life daily to the opioid crisis, rising rates of mental health concerns.
Catherine Smart is a practicing physician in the Yukon. She says Canada can't afford to wait for the pandemic to end to clear its backlog of procedures. From April 2020 to June 2021, average wait times for 8 common procedures rose by an average of over 2 months, with people waiting nearly 4 months for hip replacement surgery.
We need to find a way to move forward where we continue to address the acute concerns of the pandemic, but don't lose sight of the other far-reaching impacts on people's health and wellness that are happening in parallel.
Our own estimate, which is, of course, dependent on the information that we receive from provinces and territories, is that there would be approximately 780,000 delayed surgeries in Canada at this particular time.
Health Minister Jean-Yves Duclos says the federal government knows there's a problem. He says health systems are chipping away at the backlog, but there's still much to do. The CMA is calling for $1.3 billion in added funding to bring wait times back to pre-pandemic levels. The federal government says it's aware and ready to spend.
So we have a total of $25 billion that we want to invest quickly in support to the priorities of provinces and territories, and we know that one of these priorities is exactly that, to handle the backlogs in surgeries.
Talking about it, thinking about it, it's just not enough anymore. We are a system in crisis and we need to move forward.
In Ottawa, Xiaoli Li, City News.